There's new research out that can save your life. It's better detecting of different types of hereditary cancers in women. And today we're talking now with oncologist Dr. Lynn Parker from the University of Louisville. And we want to talk more about this because we've been hearing about the genetic testing that you can do to see what your predisposition is to getting different types of cancers. But then if you do that, what do you do with the information if you are in one of those risk groups?
I think it's really important with genetic testing that you have genetic counseling, and we at University of Louisville have a high-risk genetic clinic where you meet with a physician but also a genetic counselor to really get detailed information about that. We then do the testing and then meet back with you to go over the details of that, because you're right, what you do with that information really depends on your exact risk.
Now, we hear so much about breast cancer. Is breast cancer the most common cancer in women in Kentucky?
Well, unfortunately, lung cancer is very, very common, but in the hereditary cancer world, there's been a really explosion of information about hereditary risk, and that includes breast and ovarian cancer, but also uterine, colon, and ovarian cancer as well. So I think it's really important to know your family history in detail. If you have a strong family history of cancer, that you really pursue information about your exact risk, because there is measures you can do, both medication and surgery, to protect yourself.
You say overall, though, we are seeing an uptick in the number of women who are getting cancer?
Yes, and I think in our state we also see younger women affected by certain cancers. I'm a G1 oncologist, so in our world, uterine cancer, unfortunately, is the most common cancer we see, and that's on an increase.
All right. Well, thank you so much. A lot of good information. And if you would like more information, we're going to link you up to U of L's website. Just go to WHAS11.com. Now is the chance, if you think you may be one of those at-risk groups, to go ahead and find out your risk factors and get the counseling to see what's best to do. It could save your life.